Have you ever felt so bloated that you looked pregnant after every single meal? If you nodded your head just now, you are absolutely not alone. And this video was made specifically for you. For years, I personally struggled with uncomfortable, embarrassing bloating that made everyday life miserable. I would finish eating, and within minutes, my stomach would swell up so badly that I could not sleep properly at night. I was constantly adjusting my clothing, sucking in my stomach, and trying to hide what felt like a balloon expanding inside me. It was exhausting, frustrating, and honestly, it affected my confidence in ways I never expected. But here is the good news. I figured it out, and today I am going to walk you through exactly how to do the same. Now, before we jump into solutions, it is important to understand something. Bloating is not caused by just one single thing. There are actually multiple possible sources, and the real key to solving it is identifying your specific root cause. Treating the wrong thing will get you nowhere, and that is exactly why so many people stay stuck dealing with this for years. So here is a simple but incredibly powerful first step that I want you to try right now. Think back to when your bloating actually started. Was it yesterday, this morning, maybe a few days ago? Pinpointing that exact timeline is the entire foundation of the approach we are going to walk through together today. Everything builds from that one question, so keep that answer in mind as we move forward. Now that you understand the importance of pinpointing when your bloating started, let's talk about what might have actually caused it. If your bloating came on suddenly, the first place to look is your diet. Did you recently eat junk food or heavily processed items? Did you try a new keto product containing sugar alcohols like xylitol or erythritol? These ingredients are notorious for causing serious digestive distress. Even something that sounds healthy, like a large salad, cruciferous vegetables such as broccoli or cauliflower, or dairy products, can trigger significant bloating in certain people. Some keto bars and snacks also hide corn fiber in their ingredient lists, which can quietly wreak havoc on your gut. The principle here is straightforward. If you introduced something new into your diet right before the bloating started, that new item is almost certainly the culprit. Simply remove it, and in most cases, the bloating disappears on its own. Now, this actually reminds me of one of my favorite patient stories, and I think you will appreciate this one. A woman came into my clinic absolutely convinced something was seriously wrong. She was bloated beyond belief, looked visibly pregnant, and was genuinely distressed about it. We went through the usual questions, talked about her diet, her routine, what might have changed recently. She left with some guidance and a plan to follow. The very next day, she came back, walked through the door with this look on her face, and told me she had taken a pregnancy test overnight. Turns out she actually was pregnant. Now, we both had a good laugh about that. But jokes aside, the lesson here is real. The most practical first step when dealing with bloating is always asking yourself, what recently changed? Now, beyond identifying what you ate, there is something physical you can do right now to get some immediate relief. This is a simple massage technique that many people find surprisingly effective. What you want to do is locate two specific areas just beneath your rib cage. On your right side, just under the ribs, you have your gallbladder sitting right there. On your left side, tucked underneath, is your pancreas. Using either your fingers or a dull rounded tool, gently press into each of these points and massage in small circular motions. Do this for about 1 to 2 minutes on each side. What this does is help release trapped gas or fluid that has built up around those digestive organs, essentially giving them room to decompress and function more efficiently. You can do this sitting or lying down, and many people notice a difference almost immediately after trying it. Here is something that might surprise you. I once had a patient who struggled with chronic bloating for months. Nothing seemed to help, until she took a vacation to Florida and spent a week relaxing on the beach. When she came back, the bloating was completely gone. So what changed? Stress. When your body is under constant pressure, cortisol levels rise significantly. High cortisol triggers inflammation throughout the body, and that inflammation tends to settle right in your midsection, causing visible swelling that gets progressively worse as the day goes on. Your stomach can look distended even when you have barely eaten anything. This connection between emotional health and digestive health is something many people completely overlook. Managing stress is not just good for your mind, it is genuinely essential for your gut. Now let us go organ by organ, starting with the stomach. Your stomach relies on acid to break down food properly right from the beginning. But when stomach acid is too low, often caused by regular antacid use, that process fails immediately. The result is indigestion, acid reflux, heartburn, and of course, bloating. Here is something most people do not realize. Low stomach acid is actually far more common than high stomach acid. Many people assume they have too much acid, but the opposite is usually true. When food leaves the stomach without being properly broken down, it creates a chain reaction throughout your entire digestive system. Every organ downstream now has to work significantly harder to compensate. Undigested food, traveling further into your digestive tract, puts enormous strain on everything that follows, making the bloating progressively worse with each meal you eat. So now that we understand low stomach acid is often the real culprit, let's talk about two simple, affordable ways to fix it. The first is betaine hydrochloride. This is a supplement you can take right with your meals to help restore proper acid levels in your stomach. It essentially gives your digestive system the boost it needs to actually break down protein and other foods effectively. The second option is apple cider vinegar. Just 1 to 2 tablespoons diluted in a glass of water, taken either before or with your meals, can make a noticeable difference. Both of these are easy to find and won't break the bank. Now here's why this matters so much. Your stomach is the very first stop in your digestive chain. When it functions correctly, everything downstream, your small intestine, your pancreas, your gallbladder, all of it works better too. Now let us talk about the gallbladder. This small organ concentrates bile, which your liver produces, to help break down dietary fat during digestion. When bile production is insufficient, or if your gallbladder has been surgically removed, things can go wrong pretty quickly. You might notice burping, belching, nausea, or that uncomfortable full feeling right underneath your right rib cage. Some people even experience pain radiating up toward the right shoulder or neck alongside the bloating. Here is a simple self-test you can try right now. Press and gently massage underneath your right rib cage for about 1 to 2 minutes. If that area feels tender or tight, your gallbladder could be the source of your discomfort. The good news is there are solutions available. Purified bile salts or a dedicated gallbladder support formula can make a significant difference in restoring proper fat digestion and relieving those symptoms. Now moving slightly to the left side, let us talk about the pancreas. This organ is responsible for producing digestive enzymes that break down the food you eat, particularly fats. When your pancreas is not producing enough enzymes, which often happens due to a high carbohydrate diet or conditions like diabetes, fat simply cannot be broken down properly. The result? Greasy, floating stools, diarrhea, and some seriously uncomfortable bloating. If any of that sounds familiar, your pancreas might be asking for some help. The good news is there are straightforward ways to support it. Start by taking a broad-spectrum digestive enzyme supplement with your meals. Incorporate more raw foods and fermented options like sauerkraut into your diet. Most importantly, reduce your sugar and carbohydrate intake to take the pressure off your pancreas entirely. Now let's move further down to the small intestine, which is actually responsible for 90% of all digestion happening in your body. Under normal circumstances, this long winding passage should remain relatively free of bacteria. The majority of your microbes are supposed to live down in the large intestine, not up here. But here is where things get interesting and uncomfortable. When bacteria migrate upward into the small intestine, they start fermenting your food way too early. Think about what happens when you ferment chicken feed. You get bubbling, you get gas, you get that unmistakable release of pressure. That is literally what is happening inside your gut right now. This premature fermentation produces enormous amounts of gas, causing that intense bloating and fluid retention that makes you feel like you swallowed a balloon after every single meal. This condition is called small intestinal bacterial overgrowth, or small intestinal bacterial overgrowth for short. Here is a key diagnostic clue that can help you identify it. If you take probiotics and your bloating gets worse instead of better, that is a strong signal pointing towards small intestinal bacterial overgrowth. Similarly, if eating more fiber increases your discomfort, the same suspicion applies. To address small intestinal bacterial overgrowth, the first step is temporarily switching to a carnivore diet, which eliminates all plant fiber and essentially starves the overgrown bacteria. Alongside that, natural antibiotics like oregano and garlic are highly effective. Adding clove, thyme, and sage can further support this process. Finally, intermittent fasting is one of the most powerful tools available, giving your small intestine the time it needs to reset, cleanse, and restore proper bacterial balance. Now we arrive at the final organ in our breakdown, the large intestine. And here is where things get a little more forgiving. Unlike small intestinal bacterial overgrowth, bloating that originates in the large intestine actually responds well to probiotics and fiber-rich foods. So if sauerkraut makes you feel better rather than worse, this is likely where your issue lives. Here is something worth knowing. Most people are only eating around 1.5 cups of vegetables per day. That is nowhere near enough to feed the beneficial bacteria living in your large intestine. When those bacteria are starved of fiber, the microbial balance breaks down, and bloating follows. The solution is straightforward. Increase your vegetable variety. Add fermented foods like sauerkraut and kimchi into your daily routine, and consider a quality probiotic supplement. Diversity is key here. Different vegetables feed different bacterial strains, so the wider your intake, the healthier your gut environment becomes. So here is the simplest test to figure out whether your bloating is coming from the small intestine or the large intestine. Eat some sauerkraut. If it makes you feel better, the problem is in your large intestine. If it makes you feel worse, suspect small intestinal bacterial overgrowth in your small intestine. That one simple food can point you in the right direction without any expensive testing. Now, before you dive into any of these specific remedies, the most foundational step you can take is adopting a healthy ketogenic diet combined with intermittent fasting. Everything else builds on top of that foundation. I have put together a playlist for anyone who wants to go deeper on this topic, so make sure you check that out. With that said, thanks for watching, and until next time.